Hello, I'm Police Commissioner William Dwyer. Welcome to another season of Police Journal. This program will give you an inside look at the Warren Police Department and highlight other issues that impact our community. I always welcome your comments and suggestions. Please feel free to email me at wdwyer@warrenpd.org. Thank you and enjoy the show. Hello, today we have a special report on the Police Journal, and we're going to be talking about the swine flu. And with us we have Dr. Kevin Lokar, Medical Director of Macomb County Health Department. Doctor, welcome to Police Journal.
Good morning. Thank you for having me.
Doctor, every day for the past several months now, we were getting news about the pandemic, lining up for swine flu shots, residents clamor for H1N1 vaccine. Here's one, 47% of Americans to skip H1N1 flu vaccine. Here's one, county health department hit by cuts. It goes on and on. So today we want to talk about where we're at in the county and where we're at really in the country. I just read this article too, and if I could just read this one, it says, residents clamor for H1N1 vaccine. Want to get the swine flu vaccine? And then it says, get in line. The virus is rampant. The vaccine is scarce. Oakland and Macomb County Health Departments are only holding mass clinics to administer the vaccine. Then it says Wayne County is taking appointments, but the wait is so long that the next available appointment isn't until January. State health officials are recommending that residents call their doctors, but they don't know how many physicians have the vaccine. Then it goes on to say the Michigan Medical Society also doesn't know how many providers have gotten the vaccine, and some residents say their doctors don't have the shots. And it goes on to say 6 more people have died as a result of H1N1, including a 6-month-old Michigan Department of Community Health, 6-month-old stated by the community health officials Thursday. And there's been, what, 16 deaths reported so far?
Yes.
So, Doctor, let me ask you, is there a real shortage right now on the H1N1 vaccine?
Mm-hmm. At this time, there is. The manufacturers made projections that we developed plans on during the summer months, and they have been unable to meet these projections in terms of production and distribution of the vaccine. So they are about a month behind. So at this time, we do have a shortage situation of vaccine in the country as well as here in Macomb County.
But you do see that improving over the next couple, 3 weeks?
I think they are distributing and shipping vaccine on a weekly basis to health departments around the country, and this will continue. I think the situation will improve as we go through the month of November, but I think it's very likely that we will have more demand than we have supply of vaccine for the next several weeks, if not into the early part of December.
You hear a lot about the swine flu, obviously, and that's what we're going to be talking about in depth. Pandemic, you hear that quite often, mm-hmm. and maybe you could give us a definition of what is a pandemic.
Pandemic is a situation when there is a newly identified influenza virus that we've never seen before. And the definition of a pandemic is when this virus spreads globally or worldwide. And that happened very quickly after this virus was identified last April. Spring. Within a very short period of time, the virus had spread quickly across the United States, throughout Mexico, and then throughout the entire world. And in June of this past year is when the World Health Organization declared the pandemic.
I see. The question that's always asked is why are certain people getting, the H1N1 and others are not?
Right.
Can you explain why?
We're getting a lot of questions about this right now. During the summer months, the Centers for Disease Control and Prevention looked at what individuals in this country were being most affected by this virus, and it was very clear that it was younger individuals, pregnant women, children, adolescents, young adults under 24, as well as younger people with medical conditions. So this information was used to put together the priority groups that we're working under right now to administer the vaccine.
Okay. So who comes first in line? Who gets the vaccine first right now? Where's the priorities?
Right now, there are 5 priority groups that we're targeting for vaccination. The first one is pregnant women, and then it's people who take care of infants under 6 months of age, and that is because you can't vaccinate infants that young, so you try to vaccinate the people that take care of them. We're also recommending that healthcare workers and emergency medical service providers get vaccinated, as well as everybody 6 months through 24 years of age, and then anybody 25 through 64 years of age who has an underlying medical condition that would place them at risk for complications from influenza.
I see. Do you feel that Macomb County is keeping pace with, for example, Wayne County and Oakland County as far as the vaccine?
Mm-hmm. The vaccine is being allocated across the country based on population. So we get an allocation, Oakland County does, Wayne County. Now, being larger counties, Oakland and Wayne are getting a little bit more vaccine than we are. But we're all getting the vaccine based on our population and distributing some of that to private physicians, and then having some for public clinics that we're all conducting here in Southeast Michigan.
The private physicians, do you see, as stated in one of the articles, they're really not getting the vaccine?
Well, they are getting the vaccine, but they're not getting it in the amounts that they would like to receive.
Oh, I see. Okay.
We have allocated 65% of all the vaccine that's come into this county has gone out to the private providers, physicians and hospitals. The problem is that they need and would like to have a lot more than we've been able to give them. So not all providers have the vaccine, and those who do may not have as much as they would like. But that will improve as we go through this month and continue to distribute vaccine to them.
What are the plans now here in Macomb County as far as maybe increasing the locations where the vaccine is actually administered?
Right now, based on the amount of vaccine that we're getting, we think we can deal with that by conducting general community clinics at Freedom Hill, at least for the next several weeks. If the vaccine supply picks up so that we have more than we're able to administer at that facility, then we will possibly look at other facilities. We originally had a plan to go into all the schools in the county, and we had to cancel that plan because of the lack of availability of vaccine. So that is something we may reconsider in December, but it all depends on how much vaccine we have.
Okay. How long do you think it's going to take to, really get the entire, you might say, population that wants the vaccine taken care of?
I think it's going to take well into the end of the year.
End of the year.
And it could even be into January before we have enough vaccine to say anybody who wants it can come in and get it and have access to it.
See. Going back to this article here, 47% of Americans to skip H1N1 flu vaccine. For our viewing audience, the vaccine, I mean, it's safe. Could you maybe just clarify some of the concerns that people have and why they're not taking?
The vaccine is safe and it is effective, and much of the concern about this has revolved around the fact that this was a new virus, and many people believe that this is an entirely new vaccine, when in fact it's not. The vaccine is produced the same way as seasonal influenza vaccine. It's just that there was a virus change because we had this new virus identified. If the manufacturers had the time, they probably would have put this H1N1 virus in the seasonal flu vaccine, and then we would have only had one vaccine this year. But because it wasn't possible, because of the manufacturing process, they had to create a second vaccine that was specific for this. But this vaccine has been tested even more than seasonal flu vaccines, so there really is no reason to be concerned about the safety of this vaccine.
So exactly what held up the production of the H1N1 vaccine? I mean, it's just not being, the production's not coming out as fast as obviously we'd like it to.
The manufacturers have said, and this is well known, that the production of this vaccine is a complicated issue. They grow the virus in chicken eggs, and so there are things that can happen during the manufacturing process that can slow it down. The virus may not grow as well as expected in chicken eggs. They may have problems getting the number of chicken eggs that they need to do this manufacturing process. So there are things that can happen in the production process that may not be known initially, but show up in the process, and so that's why we're having a delay in getting the vaccine that we need out to the